The Center for Disease Control and Prevention reports that syphilis has reached alarming levels in the United States. For 14 years, the National Coalition of STD Directors has worked to call attention to the issues of sexual health and STD education, prevention, and control. Executive Director William Smith is helping to lead the charge for increased syphilis testing and treatment in this country.
Hi, my name is Bill Smith, and I'm the Executive Director of the National Coalition of STD Directors, or NCSD. NCSD represents state and local STD programs across the country and other sexual health-focused leaders in leading efforts to reduce sexually transmitted diseases and to promote sexual health. Over the past several years, we've seen significant increases in rates of primary and secondary syphilis across the country. In 2012, we witnessed an overall increase of 11%, and in 2013, another increase of 12%. And that 2013 rate is the highest on record since 1996. Early numbers for 2014 show even further cause for concern as rates continue to skyrocket and also to disproportionately impact certain populations, including gay men and other men who have sex with men. We've also seen increases in congenital syphilis, up 3.6% in 2013, and the first increase we've seen since 2008. As we have more syphilis in our communities, we will continue to see new cases rise, and that doesn't bode well for other sexual health matters such as HIV. Having syphilis significantly increases the likelihood of acquiring HIV if exposed, and also increases the likelihood that an HIV-positive partner with syphilis will transmit their HIV. That's frightening given that 52% of men who have sex with men who test positive for primary or secondary syphilis are also co-infected with HIV. We've also seen particular strains of syphilis that are uniquely and more swiftly affecting infected patients' eyesight, including resulting in blindness. As you can see, there are many reasons for concern. One way we can reverse these troubling increases is to screen at-risk patients routinely, more frequently, and get them treated quickly. Syphilis Health Check, as a point-of-care test for syphilis, is a vital new tool in our efforts to test more widely and prevent the spread of syphilis by getting testing out of the confines of the laboratory and rapidly getting patients results and treating positive cases. We don't have a moment to lose in using rapid syphilis tests to control the burgeoning epidemics that we're witnessing.
Syphilis Health Check is the first FDA-cleared, CLIA waived rapid syphilis test. This 10-minute test is now available in the United States. For more information, please contact Trinity Biotech's toll-free 24/7 hotline at 800-325-3424. To perform the Syphilis Health Check finger stick procedure, you should first organize all the materials needed. Then mark the test device with the patient's ID. Take the patient's hand and identify the finger stick location. Clean the area with alcohol and dry thoroughly. Make a puncture with the lancet and wipe away the first drop of blood with a sterile gauze pad. Massage the finger to obtain a full drop of blood and collect by holding the disposable plastic fixed volume pipette horizontally and touching the tip of the pipette to the blood drop filling to the black line. Squeezing the bulb is not necessary to collect the sample. Dispense the entire sample into the circular-shaped sample well by squeezing the bulb of the pipette, and be sure to dispense of all test and materials used in the procedure in a biohazard waste container. Allow the sample to absorb into the membrane before adding 4 drops of diluent into the sample well, making sure not to touch the tip of the diluent bottle to the membrane. Once the diluent has been added, set the timer for 10 minutes. Once 10 minutes has passed, the test result remains valid for an additional 5 minutes. A test device with a red sample well, red control line, and no test line indicates a negative result. A test device with a red sample well, red control line, and a red test line indicates a positive result. External quality control is required and sold separately. For more information, contact Trinity Biotech at 800-325-3424.